All right. Well, good night, everybody. Well, it's night where I am. I don't know where you are, but it's 8 o'clock here. So I hope you had a great Sunday and you're ready for a new week. We are going to talk tonight about California secondaries. So there are a lot of them, and there are a lot of you guys applying to California schools. So let's get into it. I'm going to do as much as I can in 1 hour, and if we have to do a part two, we will. I actually did not include a lot of sample writing in this because I realized that I wasn't going to be able to do a lot of sample writing in 1 hour. So what I might do is like a part two to this and go through more sample writing later, or I'll just show you sample writing when we do your individual schools. But I'm going to talk a lot about like how to approach them, and then we'll see how you do. All right, so tonight, or right now, we are 15 weeks away from most of you getting your secondaries. So most of the time you get your secondaries around the first or second week of July. And I just went with the second week. So 15 weeks from now is when you are going to feel a lot of pressure to want to get your secondaries turned in. So how do you budget that out? I would say take your total number of schools that you have that you're planning on applying to or that you still have left to do and divide that over 15 weeks. And that will tell you how many secondaries per week that you are going to want to do to stay on track to get these done by mid-July. If you, of course, want to go faster, then you'll do a little bit more than what that ends up being. So obviously, most of you are going to apply to 30 schools. If you're starting from scratch at this point, then that would be two secondaries a week from this point. If you keep procrastinating or have other important things like the MCAT going on and you can't do a week right now, when we get closer, then you'll be doing one a day, or one every other day. But it will become more and more intense, of course, the closer we get to July. Um, if you're a reapplicant, then you certainly don't need to rewrite all of them. You can always book editing sessions or have us edit the ones from last year, which does save you quite a bit of time. Um, but I would encourage you all, if you are not a reapplicant, to start this process whenever you can, which I would say 1 to 2 hours a day is reasonable at this point. 1 hour a day is reasonable. If you're not really a 1 hour a day kind of person, then like pick a couple of days and do two half days or two 3 or 4 hour shift, sitting sessions. But you're gonna have to come up with something that works for you. Just kind of going about this process randomly and just hoping that you make the time to do it isn't probably going to work. So you need to plan this out, carve out time, make yourself go somewhere, sit down and do it. Otherwise, if you're just waiting for your free time, you'll never prioritize this because this is horrible and terrible writing and nobody wants to do it. So, um, make the time and make yourself comfortable while you do it. So that looks like going other places, don't sit in your bedroom, don't write everything in your room. Okay, so if you are working with me with a cohort, then of course, as you get one done, you're going to send it to me as soon as you get it done. I would prefer if you send me one at a time. I would not prefer if you send me five at a time. One at a time is very doable for me. I can turn them around very quickly, much faster than like getting a 15-page document. So, if you're a package person, then that means you are going to book editing sessions. And for editing sessions, that's up to 5 pages per session. So, you would book that with any of us, and you would send 5 single-space pages with normal spaces in between, size 11 font. I'm not picky about that with my cohort, but just try to keep everything single spaced. I don't know why I cannot read double spaced writing anymore. So single space, size 11 font is what my brain is conditioned to reading. It makes me very happy. If you send it to me in any other format, I'm going to change it to that before I start reading because, again, like, I don't know, maybe I'm just a little OCD, but like 12 years of doing this, I need it to be the same every time or it doesn't feel right and I can't do it. Okay, so any questions about that?
Joanne, do you have a preference on font?
Nope. I mean, usually
Okay,
do Arial or Times New Roman.
okay, sweet. Thank you.
Any other questions? I'm not looking at the chat also. If you could just ask them, that'd be super great. Okay, here we go. All right, so most of you have heard this before, but for those who are kind of new on this bandwagon, here we are with the organization. I would prefer that you create some kind of organization system. Just having like random documents in a folder isn't going to be very inspiring to you. And you're going to hit a point where you're just going to be like over it, absolutely burned out, can't go another minute doing this. So having an organization system lets you visualize your progress, and progress, there's a book called The Progress Principle, which basically posits that people are more motivated by progress. So if you create progress for yourself, like half of our success in life is just managing ourselves. So if we know that progress motivates us to continue pursuing, then or persisting, then we have to create conditions under which we actually notice our own progress. And this is a system that I've found that works. So if you have like a list of your schools, you color code them, pick your favorite color for done because that feels more rewarding to change it to your favorite color. And then, of course, like as you get them done, you're going to see the color more and more, which makes you more excited to do more. You want to track all of your dates. So this person's on the left was very like just basic, she just put the dates that she received in the secondaries. Some people do this in an Excel sheet. I don't care one way or another, but there might be a time where I ask you, when did you receive your secondary? And I would hope you'll be able to just look at that and tell me the answer to that question. Um, you also want to track your username and password somewhere, because again, 30 schools with different username and passwords, you'll go nuts if you're trying to like look through your email all the time for all this information. So you're going to link the secondaries, the portals, you're going to put your username and passwords in one spot, and you're going to track your progress. So you can go ahead and set all that up now, just trying to get everything ahead of time so that when the rush comes, things feel a little bit calmer for you. Okay. I will say, just to be honest with you, this is probably the hardest part of the process for everybody. Um, Personal statement, nice and fluffy, we do it casually over, several sessions, no pressure. It feels kind of fun sometimes. This, there's a lot of this process there's nothing fun about it. It's just like writing these long answers and you have to answer the same questions over and over, tailoring it to the school. I'm not trying to be negative or anything. I'm just trying to really give you an idea of like, if you're someone who knows something's going to be hard, like prepare yourself for it. Because if you just go into it and you're not prepared, you'll crash and burn faster than if you go in prepared mentally and organizationally. So that's why I'm telling you this is like for a lot of people, they can't get through this process. Um, and I just want to see that you all can get through this process without having any major breakdowns. So the better you are, like just getting everything ready and set up and mentally prepared and like taking days off of work and scheduling out your time and just like really thinking like, okay, imagine if you were in a master's, program and you had to write a 50-page thesis, you would plan for that, right? Like you wouldn't just be like, oh, I'm just gonna write my thesis whenever I have time. Like you would actually create your life around it. It's kind of the same thing. It's like studying for the MCAT. You kind of have to know like, okay, in the next 15 weeks, I'm gonna write about 50 pages and they need to be written really well and they're gonna be edited. So like you're gonna have a whole basically book written in the next 15 weeks. So you just need to get ready. All right, so here are some rules that we're going to consider as we go through these questions. One thing I'm going to hear me say all the time over the next few weeks is just because you can doesn't mean you should. And that particularly pertains to character counts. Some of these schools are going to give you so little characters, you're going to wonder how do you even answer the question with what they gave you. But then there are going to be schools that are going to give you like 10,000 characters. And under no circumstance should you write 10,000 characters. Nobody wants to read that much. I actually think some schools that do that are testing you to see if you have any degree of self-restraint. Um, just because they give you the word or the character count doesn't mean you need to fill it. You need to answer the question and then stop. As soon as the question's done, stop. Don't just keep telling them things. People see space as opportunity and they're like, well, I want to tell them more about my research. I want to tell them more about this. They gave me the space. Why wouldn't I want to tell them? Because it's very self-centered. It's like, okay, I asked you a question and you decided you're going to take the space and do whatever you want with it. So it shows that you don't respect boundaries and you don't respect the question. Or you simply didn't understand the question, which is even worse, right? So if you either don't answer the question well or you do too much, they either think you don't understand the question or you can't read the question or you simply don't care and you're doing what you want. I would say none of those are good qualities. Also, sometimes people get asked questions that don't apply to them and they'll say optional and they'll go, "Oh, I really want to tell them about something though." If it doesn't apply to you, don't answer it. Just because you can doesn't mean you should, right? And then I always see things like people, write they really enjoyed something, something made them happy, people thanked them. Same kind of thing I said when we did your personal statement. We are really going to cut a lot of those feelings and that fluffy stuff out. We're thinking critically about what they're asking and we're tying it back to medicine or the school at the end. So the question is always going to either ask you about you as a future physician or it's going to ask you about you as a medical student. Make sure you read the question and make sure you're appropriately tying it back. If they ask you about community, like tying into like, how are you going to contribute to our community, blah, 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 and then you're talking about yourself as a doctor, that makes zero sense. You need to read the question and make sure it makes sense, what you're saying. Don't do the diversity questions for now. I think they may change, so we're gonna just wait that out. If we have to scramble at the end, fine. Or if you get everything else done and you want to write a diversity answer, go for it. I just have a very strong feeling they're not going to be there this year. When it comes to repeating stories or information from your primary, a lot of schools were going to ask you questions that are identical to basically the primary. Some actually ask you to rewrite your personal statement. So, in the case where the question is asking, like for literally the same thing, you have to just literally tell them the same thing. You're gonna, yes, repeat your experience descriptions. You can try to write them differently because most of the time the character count is smaller than 700 characters, but you're going to talk about the same things. The same, situations may come up in your secondaries that you wrote about in your primary. It's totally fine. You should not be a totally different person at this point. Whatever you said in your primary needs to follow through into your secondaries. So don't think, oh, this is a new space to redefine myself. They read the whole thing in the same 5 minutes. So if you go from saying one thing in your personal statement to saying the opposite in the secondary, it's going to be a major red flag. Okay, so let's start with the most daunting UC secondary question. Um, the autobiographical sketch. So, for some reason, this really makes people panic because I guess it's so long and that's why. But truthfully, once you start writing your life story, you'll find it goes really fast. So, here's how I've always told people to do this, and I've had lots of people get interviews, so I'm guessing it works. You are going to start with you were born and raised. Like I was born and raised here. Give me a snapshot. It doesn't have to literally be those words, but like by the first paragraph, I want to know where were you raised? Who did you live with? What was life like? I want to know your family culture, any languages. Like I want a glimpse into your life from childhood. And even if you had already mentioned some things from your, like, let's say your impactful experience description, if you want to like say it in a different way, this is your way, this is a story. So while your impactful experience was like more matter of fact, this is where you get to frame what happened in your life as a story. So you're using you're telling your own story. And then as we go through, eventually it's going to lead into when you got older and you're going to think about what are those things that motivated you. What's that one big thing, or it could be several things that kind of shaped your perspective on wanting to pursue medicine. I, by the last paragraph, I would really encourage you to tie it back to UCSD. I would pull in aspects of the school. So in the last paragraph, kind of weave you and them together based on why you want to be a doctor, why, what is it that they have there that's going to support that goal, and try to be as specific as possible. If there are factors throughout your story that kind of relate, I feel like it'd be really, if it's appropriate to weave the school in sooner, you could try to do that. But what this whole thing should not be is a why UCSD. So don't turn this into a why them. But if it's appropriate and there's something about what you're talking about that San Diego has, um, you can always like wrap up your paragraphs with something like that. I actually hesitate to say that because it has to be done well, and if it's not done well, it ends up turning into a UCSD essay. So I'm gonna say don't do that. Just let's just see how it goes, and then if there's something I know about, we'll weave it in. For now, let's focus on just doing what UCSD at the end in the last paragraph, and the rest let's just tell your story. Any questions about that? No questions? Do this one, UCSD doesn't send these out immediately. Some people get them really fast and some people get it later. So you can do it early just to get a head start on it. There's a possibility you won't get it right away and it'll feel like a waste. But Oh, and I actually want to say, I should have said this at the beginning. Um, I need you all to hear me loud and clear that there's a very good chance that questions could change from year to year. So there's always a risk when you pre-write secondaries that you're wasting time. And it's very rare that every question changes. Um, I have absolutely no way of knowing if a school is going to change their question. When it does happen that they change after you had written it, of course you're going to be frustrated, as will I. But I can't do anything about that, right? I have no way of knowing, neither do you. And the choice is either you deal with being frustrated that you wasted time, or you deal with being frustrated trying to write 50 pages in the month of July. So you have to pick and choose your battles. I would personally say the risk is worth it. I would rather you have most of them done than wait. But I just need you to know that everything I'm showing you tonight was based on previous years, not this year. Of course, I have no way of knowing this year's until July. Okay. Okay. UCLA is probably the second most daunting one, and it's actually one of my favorite ones to write. UCLA, a lot of my applicants get interviews at UCLA, and I think it's because of the secondary. I'd like to believe it is. So if you read the secondary, the first question, it's basically saying, we know students are provided with everything you need to become an outstanding physician. So it's like, yeah, we know you're going to be an outstanding physician, but what else do you want to do besides just being a good doctor? What are your goals? And so important societal missions would be something that's like addressing some kind of inequity, some kind of something that serves the larger population beyond just being a doctor. So you want to pick, I would always just focus on one, major thing that you have already said about yourself. And this paragraph is very short, 800 characters. So you would say your opening would be, I want to be an outstanding physician and the next thing. So the next thing could be a clinical researcher, it could be a public health advocate, it could be um, policy, someone who contributes to policy, an administrator, a leader, um, somebody who shapes something. But the thing that you say can't just be like a quality of a good doctor. Like, I want to be an outstanding physician and someone who listens to my patients. Well, that's what an outstanding physician does. So that's not what they're asking. So make sure the quality you highlight is not just a quality of an outstanding physician. It needs to be the other thing you're going to do when you're not treating patients. I think the expectation for most schools is that you're not only going to be a practicing clinician, is that you're going to do something else too. So what is that other thing you're going to do? And big schools like UCLA expect you to be a leader. So there are certain things, of course, like going into public health, you don't have to be the president of anything, but you just need to show that you have the capability of contributing to something bigger than yourself because big schools expect people to do big things. Um, okay, so respond to the following. The next four, this is not a question. So the respond to the following is not a question. This is just saying, based on what you just said, your career goals in relation to your statement, tell me about these three experiences that relate to that goal. So, this is not just tell me your best leadership experience. This is how does your leadership, entrepreneurial, or creative activity relate to the goal? So, I'll be reading these and someone will tell me that they're a painter, and I'll be like, what does that have to do with anything? I really don't think UCLA cares that you're a painter. I think they want to know that you have done something that shows your commitment to this interest of yours. Creative activity doesn't have to be art and crafts. It could be developing something from scratch that serves a larger purpose. So you have to take whatever you choose to highlight here about yourself and tie it back to the thing you already said and or UCLA. Any questions? So this one is always like the roughest for people because they'll put leadership and then they'll talk about service. So unless you're talking about servant leadership, if you put leadership, you need to highlight leadership. Entrepreneurial, obviously creating something. Questions about that one? Okay. Same thing with volunteer work, scholarly project doesn't have to be a research, although most people do. If you didn't do research, then you would just talk about maybe like having done a project for a class or a lit review, anything that where you did, read literature or did some analysis. and came up with data. Um, I don't know if the COVID essay will be here this year. I hope not, but if it is, most people just write that they were not severely impacted by COVID unless they were. And then the gap year one is pretty basic. So for the gap year, you want to think about what you're currently doing, or not what you are literally currently doing, but what you're going to be doing in July through the following June. And you want to put both your work, your full-time work experience, and your volunteer experience. If you are going to be learning Spanish, you can indicate you're going to be learning Spanish. If you are going to be um, getting married or taking a trip, something significant, then you can indicate that there. But if you're just like working part-time and gonna chill and hang out with your family, absolutely don't say that. You want to indicate that you are working full-time or at least doing enough things to equal full-time. Okay. Davis is really hard for people because of how short it is. So the first one is if you only have elements that you think would be concerning. I will tell you what is not concerning, having one or two C's in your application. Do not write that. Don't write if you're just going to talk about a C or two. Having a very low or incon like having a really low CAR score or having a really low MCAT score, possibly you could talk about, but you again, like we have to be really careful about that. Having a low GPA, but we're going to highlight your upward trend. Um, Essentially, the thing we want to say here is like you might feel concerned about my low GPA. However, if you take a look at my upward trend, you'll notice that I have been able to demonstrate my ability to handle a rigorous doctoral level science program through my last 2 years of post-bac work. So even though you're going to say you might be concerned about this, this is why I think you shouldn't be concerned about this. Like not like having a long gap with no work experience. You can say you might be concerned why I took 2 years off of work. What were you doing during that time? Okay. Connections in Northern or Central California. They're looking for people who will stay in the area. So you either have it or you don't. If you have it, fantastic. It's just matter of fact. My entire family lives wherever. I went to school in Northern California. I've come to Sacramento often. You need to make it clear why you want to be there. If you do not live in Northern California and you have zero connections, it's a little harder. So I would look up, I would try to draw parallels between whatever community you're in and Sacramento. Look up the demographic data in Sacramento, like identify some of the, some of the biggest problems in Sacramento are the same problems in different parts of the state. So just look up some stats on Sacramento, show that you've done your research, talk about one of the 9 student-run clinics, pick one that most ties to your experiences, talk about wanting to contribute to, producing greater health equity in Sacramento or Central California, whichever one makes more sense to you. And then for the three meaningful, most people are like, oh, I'm just going to copy and paste my meaningful, but look how many characters it is. You can't take 1325 and cut it down to 500. So it would be much easier to just rewrite it and just put your three meaningful at 700 characters and then cut it down to 500. The whole point of this is if you hadn't gotten a letter from one of your three meaningful before, make sure one of the three meaningful on this one are from one of your letter writers. So that's important to UC Davis. Um, yeah. Any questions about UC Davis? Okay. All right, UCSF. For the first one, I usually tell people to write to, like, if you have a new job that you're going to do over the next year, definitely talk about that. That'd be your first priority. Or if you're starting a new job in the fall, or if you had just started a job, anything that's like not in your primary app, talk about that. If you have no changes, everything you're doing now is what you're going to do then I would pick two of your most meaningful and then just write, like, tell a story, like, dive in deeper, pick one big thing about it you want to highlight and, like, just talk more about it. So, like, treat it like another meaningful description, but with a little bit more characters. Again, you don't have to use all 500 words. If you use 400 words, you'll be okay. Um, if this is your gap year, like if you have, oops, If you have graduated earlier than last year, they want to know what did you do? If you just graduated, so this will be changed to 2026. If you just graduated this spring, they generally don't care. They don't want to hear like what you did in the last 2 months. They want to know like what are you doing? Like what did you do if you took more time off? Okay, and then the pride, oh gosh. Okay, I don't even know if I can remember all five. So professionalism, resilience, integrity, diversity, and E is who knows? Equity? What's E? Does anybody remember? Well, anyway, so what most people do, you'll look it up. What most people do is they will write a little bit about each of them and show how each of them is illustrated through an experience. So you can either do it that very basic way, like, oh, P for professionalism, I did this for, or maybe R is respect. No, E is excellence. Oh my gosh, see? Not equity, excellence. Okay. So you could do it that way. You can like show one example for each one, or you could find a way to tell one story that epitomizes all of these, and then just work each of those words in through the whole story. Um, Not really, like you can either make it obvious that what you're doing is like demonstrating excellence, or you can literally say through excellence or through blah blah blah, I demonstrated excellence. One way or another, though, they want you to show how you have done those. Any questions about UCSF? There is a program called JMP, and I have had applicants apply to it and get the interviews. It's a program that is, I think it's taught at Berkeley, and then you transfer over to San Francisco your third year. It has another like 7 or 8 questions, like quite a few questions. I didn't list them all. But if you are interested in the JMP program, you can look it up. It's just like a special pathways program, and you want to, um, I mean, obviously think about if that's what you want to do. And I don't know if there's any pros or cons to doing it. It's kind of like UC Davis has several, I should have said that. If you want to apply to any of the pathway programs, it's going to have a whole separate application that you're going to do when you do your secondary. So it's going to ask you, do you want to do like ArcMD or Prime or Rural, or what are the other ones? Teach. And if you do, you click yes, and then you're going to answer more questions. So just include those in the document whenever you write them. It's okay if you want to apply to more than one. Just make sure you really want to do it if you apply. Okay. So, Irvine, a personal accomplishment that you are most proud of. A personal accomplishment in my mind is not a academic accomplishment. It's like something that you have personally achieved. So I've seen so many things here. Sometimes people will talk about like something very concrete, like, you know, going to the Olympics. And other people will talk about not biting their nails anymore. So whatever, whatever you decide to show here is going to give them an indication of who you are. If you are, not someone who's met the president or have a patent or published anything, then you're totally normal and you might talk about something that's a little bit more personal to you. Building a relationship with someone, maintaining a relationship over 30 years. Well, none of you are 30. 20 years. I don't know, just something that means something to you. Because again, like you get to all these stories, they're not really looking at these stories going, oh, like, what is the most impressive thing? They're going, who is this person? Like, whatever you talk about, it gives them an indication of who you are as a human. You get to decide how people understand you. There are many gorilla type out there who just pound their chest and want to sound really big and important and special and unique, and let them do that. There's so many of them that they don't even stand out in this process anymore. But if you are a little bit more thoughtful and reflective and you don't need to pound your chest and make yourself sound so important, and you think about your life a little bit deeper than your simple accomplishments, then you will probably actually stand out more to them because it's refreshing. It's like really refreshing to hear from somebody who is a little bit more thoughtful about things than just, screams, look at me. Okay, describe to the admissions committee a challenge or disappointment you have overcome. So you want to read these questions really, really carefully because not all challenge questions are phrased the same way. So a challenge you have overcome. You have to think about, you know, talking about your life. Like let's say you had a terrible childhood and you're talking about, overcoming. Like, what did you specifically overcome? You didn't overcome your whole life, but maybe you overcame the self-doubt that was instilled in you at a young age. Think of something, and it doesn't have to be life related. It could be a work related challenge, or a disappointment might be, working for 6 months on a research project and realizing it produced absolutely no findings, and then needing to like just move on with no paper, nothing. Those are fun challenges because they're real and that happens all the time. So, what you learned about yourself is a very, very important part of this question. Um, you want to think about a really powerful like reflection here that you can apply to medical school or beyond. So, if a challenge like let's say you learned about yourself that, when you're faced with challenges, you know to, take a step back and think about it from some other perspective. I don't know, I'm making something up. Whatever that is, like, how would that be applicable to medicine? And if you can tie it to medicine, all you do is you say something like, you know, when I'm facing disappointments that feel insurmountable as a medical student, I'll remember this lesson and, just take a couple of days to decompress before I make any major life decisions or something, whatever it is. Um, Have you ever had difficulty accessing quality education or healthcare? So this is one of those just because you can doesn't mean you should questions. If you have not had difficulty accessing quality education or healthcare, you would say, I have been very fortunate. I have been able to access quality education and healthcare throughout my life. You could say, I have seen how others have been impacted, but do not take the entire characters to then talk about your experiences. Because again, this is not for you. This question is not for people who have had quality education and healthcare. This question is for people who have not. So it would not be appropriate for you to keep talking about yourself in that way. Because think about it from the other perspective. If someone did not have access to quality education and healthcare, all they get to talk about is how they were not. They get to just talk about their life. But if you think, oh, I'm going to tell you about this amazing experience I had doing something cool, that doesn't seem very fair that they are forced to tell you about their life, whereas you get to highlight a cool experience. So make sure, read the room. If the question is not for you, don't answer it. Have you completed your bachelor's degree? Yes, no. And then make sure you clarify when you're getting your degree if you have not. Um, what is this saying? If you have just received or will receive your degree and discuss your plans. Okay. So this is a gap year. They just want to know, like, when are you graduating? If you did graduate, what are you doing already? Or what are you doing for the next year? Um, any questions about UCI? No. Okie doke. All right. Riverside's a little tougher. Because I think the first question causes a lot of problems. So let's break down the question and look at what it's really asking. So I was in a meeting the other day with UC Riverside School of Medicine admissions, and they said a couple things that really struck me. They said, we're not looking for people to reinvent the wheel because we've been trying to do that and it hasn't worked. So what we want to do is look at what is currently being done and how can we fix what's currently being done. And they actually think that the Inland Empire has some very unique challenges that the rest of California, I guess, isn't facing. Um, and so I think it would be in your best interest to look to really study the Inland Empire and understand like what's going on in inland Southern California. Um, and then the question is, in order to serve our region, so the most important thing to UCR is that you're going to stay there and serve in their region. You want to live in that area. So they want to train a workforce of physicians who want to develop innovative research and healthcare delivery programs. So we all understand what innovative research means, but do we understand what innovative healthcare delivery programs looks like? Can someone give me an example of an innovative healthcare delivery program? Anybody?
Or like doing some
Very,
kind of assessments like via telemedicine for people who can't don't have mobility to get into the clinic.
Yeah, so telemedicine would be an example of a healthcare delivery model. Whether we would consider that innovative, maybe, maybe not. Did someone else have a different idea?
culturally targeted care is generally like a way that they kind of like tailor care. I don't know if that's considered like healthcare delivery, but
Yeah, I would think no, I think that's just like how you treat patients. Like when I think of healthcare delivery programs, I'm thinking of things like ambulatory care or um so some programs, like some medical schools right now, are having people go into people's homes and they're teaching people how to do home care. Some medical schools are, obviously telemedicine is out there. They do mobile clinics. Obviously, student-run clinics are not that innovative, but it is a healthcare delivery program. Street medicine is a healthcare delivery program. Um, Even something as simple as like giving patients smartwatches and monitoring their blood pressure from stations, so that, or not blood pressure, heart rates or whatever. So just something where it's like different, it's innovative. It's like how do we manage people's diseases in a different way? So the more creative you are with this, like if you have an idea for how you want to deliver healthcare, so something that's a little bit more innovative. So how are we going to improve the health of medically underserved in the region and become models? So they want UCR, whatever you guys create while you're there, to be emulated throughout the state and nation. So similar to, what I said about UCLA, they want leaders. They want people who are going to actually create and do something for the region and state. So they're saying, what have you done that's going to help us do this? Tell us an example of like sometime when you created something innovative that actually solved a problem. You can see why this is challenging for some people, right? Um, and then the next question, these are their values. Choose one and tell us how you have experienced or emulated it in a clinical setting. And then what type of healthcare setting do you see yourself practicing? So healthcare settings include things like hospitals, clinics, community clinics, maybe global health settings or military medicine or military hospitals, or maybe you see yourself volunteering sometimes in street medicine. So you can kind of break it up if you obviously see yourself in different spaces. A lot of people do. You could say, I see myself spending 70% of my time in a hospital offering, inpatient care. I want to spend 20% of my time in administrative roles, leading some projects, or I see myself, participating in clinical research. Um, Whatever that looks like for you. They just want to see through your eyes like what that looks like. I probably wouldn't say you want to do global health for UCR because obviously their main focus is you staying there. Tell us about a personal challenge you have faced in your life so far and how you demonstrated resilience and grit to overcome it. So, the spotlight here needs to be shown on the resilience and grit part. So, how have you demonstrated grit to get through it? So, you want to literally like show how you did that. Not just that you did and how great you are now because of it, but you want to get into the nitty-gritty. So, when this thing was really hard for me, what did you do? And in order to prove something was hard, you kind of have to say, like, there were many days I wanted to give up, or, I cried myself to sleep, or whatever it is. Like, you need to show the difficulty in order for you to show the grit. So I think that's hard for some people to get that vulnerable and really show a struggle that they faced. Because this is a personal challenge. This doesn't say a work challenge. So it needs to be something from your own life. And then the last one, is there anything else you'd like the committee to consider? Yes, the answer to this is always yes. Most of the time, it's usually yes. And I would do a YUCR here. So I would find a couple of really specific things that the school is doing there and tie it back to your career goals. Any questions? Okay.
Oh, Joanne, actually, sorry, I have a question about UCR.
Yeah.
With the being vulnerable and like personal, like what would be examples of like because I don't know, I was thinking like relationship issues I've had in the past, like with pursuing medicine, like but I don't know like how vulnerable or like
I mean, I think it could be anything from having like a strained relationship with somebody to, overcoming an eating disorder or having
Mhm.
experienced a personal health crisis. Um, something that you have had to work on for yourself, something that really pushed you, like, um, yeah, I mean, there's so many possibilities.
Would you stay away from mental health or
I personally wouldn't talk about, yeah, I wouldn't just say
okay.
like depression or anxiety. I would try to find something more concrete.
Okay, sounds good. Thank you.
And actually, I just want to say why is like the resilience and grit part. We do have grit when we come out of depression. I 100% believe that and know that for a fact. I just think that there also is oftentimes an appropriate space for like treatment, like medication and therapy. And so if we're like using medication and therapy to overcome our depression, it is a little bit more of that probably as much as it is your own grit. So I think what I'd really like to highlight is the actual grit part, not your decision making and pursuing treatment.
That makes sense. Thank you.
Mhm. Okay. All right, Kaiser. During your career, you will likely encounter obstacles, be required to overcome challenges, describe your experience with a situation that had an unfavorable outcome, including your reaction. How do we react to unfavorable outcomes, people? We're not happy, right? Make sure you show that. Make sure you show how sad or disappointed you were. Make sure that's part of the story and how you would have responded differently. So if you responded wonderfully, you can't really say that you would have responded differently. So we need to show the negative reaction, which again, vulnerable. Nobody wants to say they didn't respond to something well. So something happened, it didn't work out for you, you were not happy about it. How would you have done it differently in the future? And then what did you learn about yourself? Is anybody hating this yet? Okay, just me? Okay. So I'm not even the one writing this, and I already hate these questions. So these questions make you say these things that are not natural for us to talk about. But why do they want to know this? Like why are they asking you this question? Who can tell me?
Um, my guess is probably they want you to first of all be able to acknowledge a situation that doesn't make you look very good and be able to acknowledge, yeah, my reaction wasn't right in this situation. And then on top of that, say how you would fix it or like give a solution.
Yeah, but why? Why do they care about that? Why are they asking this? They could ask anything.
Imagine because like they want you to be able to be like self-critical and identify when you've made mistakes and know that you need to fix them.
I don't know about some making a mistake. This is just something that happened to you. Like you
Yeah.
had an unfavorable outcome. Why do they specifically care about this attribute?
Just to show that you can have an unfavorable outcome and still like keep pushing through and not you're not gonna
Right.
down.
Yep. But I think I think the reason they're asking this particular question is all the questions is because this is something they're dealing with. So in medical school, do you ever have unfavorable outcomes?
Yes.
100%. You will not get your rotation that you expected. You might not, have a physician who says yes to you for your research request. Like many, many times, something bad is going to happen in medical school, like more often than you might think. And when those things happen and you have absolutely zero control and you just have to deal with it because there's no option, you don't get to choose, how do you deal with it? What do they want you to do? Smile and nod and move on, right? How do you think med students respond to it?
Probably fight
They
fight
fight.
it.
They fight,
Yeah.
right? They write letters, they protest, don't show up to class, they go in the dean's office, they complain, they throw fits. So why in the world would a school care how you respond to something that doesn't work out the way you want it to? So they're trying to produce good little minions. They want people who are easy medical students. So you need to choose, you need to understand what they want out of you and then think about a situation that would parallel that. Okay, one time my school, decided to get rid of my minor, and this was my favorite minor, and I was so happy. And then when they got rid of the minor, I was really upset. I took a few minutes to reflect on why it was. I researched, I found out they needed to save money, and I was extremely disappointed. However, I maybe like, I was bummed about it for 2 days and then, I realized I have to move on. So how would you respond differently? Maybe, you just like pick some element of how you responded. You're like, I think that I would have taken the time to ask some questions and then, maybe gotten over whatever faster. Or maybe you did do something not great, but I wouldn't highlight the worst of your behavior, right? Like if your behavior was, stormed into the dean's office and yelled at him. I would obviously not highlight that. I don't need to tell you that. But I want to say that because, like, again, you have to think about it from their perspective. And anytime you have a question, you're like, oh gosh, why are they asking this? Just always try to think, like, why would they ask you this? What are they getting out of this that's helpful to them? And this is a really common problem in med schools where medical students throw kind of little hissy fits when they don't get what they want. So just keep that in mind when you're writing it. Um, so Kaiser's dedicated to graduating courageous leaders. Here we are in California and the more leadership stuff, right? Who lead change through inquiry and innovation in medical education, the profession, and the healthcare system. So they want leaders who change things in three spaces. Medical education, which is not, that's like teaching. So they want innovators in medical education. They want innovators in medicine, and they want innovators in changing the healthcare system. How do your values align with this mission? You cannot say, my values align with your mission. Obviously, you need to give me evidence that that is the case. So, when have you ever led something that had change in a way that would impact the concept of like changing a process that educates others or improves the way you delivered care to somebody or improves a process that was built for like let's say a clinic. Let's say you changed a procedure or a policy that improved the system for everybody. So you would make that very basic statement about how you align with Kaiser through which has been demonstrated through this, and this. Um, do you understand? Do you see what you have to do here?
Do you have to do all three?
Do you see an or? I'm looking for
No.
it. Yeah, it says and. So I don't know. If you don't have all three, do whatever you can do. But this is what they're saying they want. All right. Lifelong learning is an essential process for continued professional development. This includes reflection and being open and responsive to feedback, constructive feedback. Tell us about an area of intellectual exploration you're passionate about and your approach to exploring this area. People hate this question. Okay, so the reason I think people struggle with this is because an intellectual exploration you're passionate about is it can be a subject in school if you have actually demonstrated an exploration of the subject. So, for example, let's say you have a passion for environmental health, and you've been able to explore that by having a minor in environmental health, and you have done research in environmental health, and you did an experience in regards to environmental health. You need to have more than one touch point for something you have passion for, right? Like if you're passionate about something, you have looked at it, read about it, done it, tested it, practiced with it. Like you need to like show how you have explored something. So some people have something very easily. I remember a guy like he was passionate about aerospace, something planes basically. Like he was really interested in airplanes. And he had spent years like reading about them and he talked about, all of that. And how he has explored that area of passion. Not a lot of people have something here. And when you don't, you're gonna have to just think until you do. You have to come up with something if you're gonna apply to Kaiser. So I don't have the answer to this for you. You can't say, what should I put? I have no idea. You're gonna have to tell me something you're passionate about. If you really cannot think of a single thing, you're gonna have to choose just a subject in school and show how you have done something like that. But exploring something intellectually should require some degree of reading or research. I saw a hand up.
Yeah, just a quick question about that. Is there like a better way if you make it like kind of more healthcare related or not healthcare related? Is there like if you have multiple ideas in your head, a better way to approach it, like those two?
I don't think it needs to be healthcare related. I think it can be. I think that they just want to know, 'cause the whole point, like read the first line, like they want to know that you can consistently study the same thing over a long period of time because you're going to study medicine for the duration of your life. And so they want to know that you have studied something for a long time, like something you have passion about. So whether that's healthcare related, what would it be? Like, what would be an example of something you have read a ton about, you've done stuff with it. It's not just like what you want to do, but it's like you need evidence that you have already done it.
Gotcha. Okay, makes sense.
You know, for you, Rio, the first thing that comes into my head is not healthcare. It's the thing you've done most of your life.
Okay, that's kind of what I was thinking too. I just wasn't sure if I should go more of a healthcare route.
No, I think that you need to go with the thing that you have spent the most time learning about. And you can even then work in constructive feedback. If you can incorporate constructive feedback, meaning this is something you've pursued so long that's people like you're in a situation where people are giving you feedback on it, that's even better, right?
Gotcha. Okay, perfect. Thank you.
hmm Um, Drawing from your lived experiences, how do you think knowledge of social determinants of health can be leveraged to address social justice issues? Okay, I wish this question stays. I hope it does. I don't have a lot of faith right now in anything. So, if it does stay, great. I'm going to talk about it, but I think there's a possibility it could change. There's a long list of words that were supposed to get scrubbed, and it looks like it wasn't scrubbed last year, but I don't know how bad situations are right now and how words might be coming out of things. Okay, drawing from your lived experiences, how do you think knowledge of social determinants of health? So, how do you think knowing the things that affect health can be used to address social justice issues in healthcare? So, what is an example of a social justice issue in healthcare?
How much Medicaid is reimbursed?
How much Medicaid is reimbursed?
Yeah, because of like Medicaid being primarily for populations in the US that have lower socioeconomic status. And so then the justice component of that is their reimbursement rates are really low, like insanely low, so they can't get access to a lot of levels of care.
So, the person being impacted is the doctor,
No, the patients, because they don't get they're not able to access like most care that would be appropriate for their conditions
but
because
that's
they're
because the doctor's greedy and doesn't want to get paid less.
no, that's because hospitals, or not hospitals, but unless you have maybe private practice doctors, but most places will
I
have a
shouldn't
block
say
of it.
doctors are greedy. The system in which doctors work is greedy. Uh,
Yeah.
when you become a doctor, you are the system. You are part of the problem, right?
Yeah. So there's not the social justice component, the fact that the systems are greedy and
Yeah,
then
but I'm trying to, okay, yes. But I think you got to rephrase that because I think it boils down. Okay, so reimbursement rate. So the system built reimbursement rates to be low, and the healthcare system won't see people because they don't get paid enough. So people are left without care.
Yeah, and that's a systemic inequity for people who are socioeconomically disadvantaged.
And so, how does knowing about someone's social determinants of health allow you to address that problem? Like, how are you going to address that problem as a doctor?
If you develop your own system, then, or by system, I mean clinic or practice, then um, like you can leverage technology to see patients in more effective ways, to basically see more patients and recover finances when it comes to like um, the reimbursement. I know it's a complex thing I'm saying, but maybe I overshot the question. But like technology has allowed us to leverage time, so like we can see more patients, which allows you to see patients who then whose reimbursement rate
I think you're
almost
going
as
too
high.
far with this.
Yeah.
I think it's like based on your lived experiences. How do you think knowledge of social, I think you're overshooting. Let's just keep it basic. Let's keep it really
Mhm.
simple because all they're trying to understand here, A, that you understand what social determinants of health are, and that you know how to address them in a way that basically provides equity to people. So let's think of a more down to earth social justice issue, like something that impacts patients.
Maybe, sorry, I do like racism
Okay.
and certain derogatory terms are used on patients in
Yeah.
healthcare setting.
Okay. So I think that a really common thing in regards to racism in medicine is the historical issue of Black patients not being treated the same when it comes to like pain medications, right? We all know about the history of that.
Yes.
Okay. So, um, obviously, race is a social determinant of health. This is really basic. I'm gonna like keep it super simple. So, the knowledge of social determinants of health, like knowing, understanding the ways that race impacts health, can be leveraged. You understand that going into medicine so that when you are a physician and you have a person in front of you who may have experienced social injustice in the past, you can use what you understand about the ways that race can impact health to uh well, social justice is making up for previous injustices. So what do? Well, you check your own bias. You recognize bias in other people. You make sure you listen to your patient. You make sure you believe your patient if they say they have pain. If you really, you take the additional steps to restore justice in a way that builds trust, rebuilds trust, um, creates that bridge, and yeah, like basically restores. I don't know how else to say it. So, how do you show all that in 250 words? Um, you're gonna have to keep it short and simple. You could talk about kind of going back to what I don't know who was saying that. I'm guessing it was Talha. Going back to what we were talking about with reimbursement rates. The issue is that patients can't access specialists in certain hospitals, I guess. So patients are limited in how and who they can access for care based on who accepts Medicaid. So the knowledge of social determinants of health. I guess like let's say you're making a referral to a provider who does accept Medicaid, because that happens all the time, right? Like, let's say they have to drive an hour away because the only provider who does that type of surgery is an hour away in another city. And that's the only provider who will accept that insurance. So, knowing social determinants of health means you ask your patients, do you have a car? Do you have a reliable way to get there? Do you have, people in your life who can drive you there? And you recognizing the impact of their social determinants on their health outcomes just means that you take a few minutes and address those. Um, I don't know, that's really hard with the social justice issues. I'm struggling with that part of it. Yeah. I don't think that works. So this is why it's tricky. This is why you have to like think hard, and it has to be based on something you've already seen. It can't be like hypothetical. So, you see why do you understand now why I'm saying I don't like this? Why this process is terrible. It takes a lot of thought. It's not something you whip up quickly. It's not something you're just going to throw together. You can try to use AI to write it. I don't think it's going to turn out well if you do that, but you can try. Um, I think you just need to sit and think, having conversations with people, like really thinking hard about what they're asking you. And just thinking like, okay, like maybe make a list of social justice issues to start with. And then like you can look up what are social justice issues in healthcare. And then, okay, how would one of those that you identify, like how would knowing about social determinants of health help me address that? And then you just need to think of a time when you actually did that. All right, I'm gonna move on for the sake of time because this one's rough. Kaiser is a very hard one to write. All right, CUSM. Again, with the diversity, I am not sure you're going to write that, so we'll skip that one. The last time you were criticized by a peer or supervisor, when you do this, just make sure you use the word criticize. Make sure it was actual criticism and not just like feedback on how you did your job. Because like if you did something wrong in your job and someone gave you feedback, I don't know. To me, that's like just normal feedback. I think criticized, I think it's like a little bit more harsh. And then how did you handle it? Clearly people don't really like criticism most of the time, but you can say, like, while it was hard to hear, I recognized, where this person might have been coming from, and then reflect on how you handle feedback in the future. So this one, you definitely want to tie it to med school and say, like, when I receive criticism from, my supervising attendings or my preceptor or whoever, I'll try to not take a good lesson in criticism is like not taking it personally. So if somebody criticizes you, like just try to let it go and just like try to learn from it, but also, you know, we don't have to go in the bathroom and cry every time. All right, give an example of when you had to work with someone who was difficult to get along with. Why was this person difficult? Very common question for interviews. So this, I love a good, personally, I think the funnest ones are my PI stories. I absolutely, the funnest one I always remember, I have two people I can think of who took this route. They talked about their PI who was just like absolutely brutal with them, like just tore into them for every little thing they did. And they just painted it in such a humorous way. And if you're gonna, you can do a couple things with difficult people. You can literally like paint an actual really difficult person who is just like very, very hard to be around. Or you can paint it as like a boss who was just like brutal, but also like don't be so sensitive about it. Like in retrospect, like just paint the picture of like this person like call you stupid or just do something really like really bad and like how you like at the time, like you go home and cry every night, but then like as you went through it, like you grew thicker skin, learn not to take it so personally. You would either handle the person by having a conversation with them and coming to some terms, or you literally just like handle it by like taking a deep breath and like just doing your job and getting through each day. There's different ways you can handle it. I probably wouldn't say I went up to HR and got him fired. That's probably not the best way to handle the person. But it's more like you are going to have difficult people. You are going to have difficult professors. You're going to have difficult colleagues, and you are absolutely going to have difficult doctors who are going to be mean to you. And when you do, how do you handle it? And the best thing, especially for people who are above you, is deep breaths, right? Like you're not going to fight every person who's mean to you, and you're not going to change it. You're not going to get everybody fired. I've learned in my own life in my 20s, and I had terrible bosses. I used to think if I just report them that, even if I leave, they'll lose their job. They don't. They don't lose their job. They stay. You just leave, and then you end up becoming the bad guy. So, they know that I know that. Maybe you don't know that yet. Um, so they want to know that you have some sense of like you're not gonna get every difficult person fired. What would be the best example that shows you're a person of integrity? So you need to tell a story where you demonstrated integrity. And then just tell the story and then talk about how you bring integrity to medicine. If given the opportunity to attend a medical school, where would you see yourself in 10 years? Yeah, that's a fun question. It's kind of like what we did in our conclusion of our personal statement. So you can take your conclusion and just focus on a little bit more of that. Like, it shouldn't be different though. If what you write here is not the same as what you said in your conclusion on your personal statement, then it's a problem. Again, same person, same 5 minutes reading the entire app. Make sure you're not changing it up too much. Okay, any questions about anything? I told you this was going to be hard to do in an hour.
Oh, Joanne, I have a question about UC Davis.
Hmm.
So for the meaningfuls, like two of my meaningfuls are not connected to letter writers. Is that
You
okay
just
that
need
I just
one. You just need one that
oh,
has,
just one.
yeah.
Okay, perfect. That makes me feel better. Thank you.
Yep. Mhm.
I
Okay.
have a quick Riverside question.
Yeah.
Sorry.
Oh,
So, for the demonstrating grit, and or resilience, do you have to have like fixed the issue or solved the problem, or can it just be something like, yeah, I got through it and like accepted that it sucked? Like,
I think
is that
so. Yeah, I think that's
okay?
common. I think if it's asking you for how you handled it, like I don't really know if they care what the outcome was. It's more just like how did you survive it?
Gotcha. Okay, makes
Because like
sense.
think about OChem, right? For a lot of people, like they don't really they don't really do well in OChem, but they survived it. It's like how did you get through it?
Gotcha.
What is the okay, so USC, I every year hope that they're going to change these questions, and they never do. Actually, they changed it a couple times, but not enough to make me happy. So these are the questions. The top three have been the same for about 3 years. They used to have one about public health a few years ago. I really like that question. But here we are. This is as of last year. So it's very short. And for the most fun, I would just be honest, like, what is something you did for fun? I once had someone say, well, I think my work in the research lab is fun. Absolutely not. Don't say what work is fun. Just say something you do to relax. Nickname one is kind of fun because you want to think about it symbolically. So, what is something that you do that you would want them to know about? For example, like let's say you want to talk about being a chef. You love cooking. So tell them, create a nickname that makes sense for you and say I would do this because of my favorite, like I love to cook something. Like just give them something about yourself. Tell them about you. Three things you don't care about at all. I literally hate these questions. I could not hate these questions more. Um, I would say if you want to do something silly, just do one silly one, but like try to make it somewhat meaningful. So something you don't care about, like if I were doing this question for me personally, I would do, let's see, something meaningful. I don't care about spilling coffee um on myself as I walk around with my ceramic mug. I try not to use paper cups as I'm drinking out of a paper cup. Something like, okay, well, I try to use ceramic mugs so that I don't have to use paper cups all the time when I'm like at stores or at restaurants. Like, okay, so that indicates like I have some interest in environmental health or yeah, environment. Something like think about things that matter to you and then like flip the script. Even I'm struggling to think of this. So obviously these are not something you're gonna think of quickly. Like think about it think about meaningful things about you. Maybe do a brain dump first of like all the big things about you and then like try to find ways to flip it where you can show something about yourself through what you don't care about. If I was gonna do a silly one, I would say um I don't care about swimming in the ocean. I don't want to get eaten by large mammals. Like I cannot go in ocean water. Sorry, Aaron. I don't care. Maybe if it's like crystal clear and flat, I will go in the ocean water, but like I will never go in the ocean water. So like, because I don't like the fact that there are whales in there. So I love whales from a boat, but not next to my body. So anyway, that would be an example of something I don't care about. So you would just list three things. That's all you're literally doing. Something you didn't get that you deserved. Most people talk about not getting a position in their clinic or not getting a publication. My favorite one that I remember from years ago that continues to make me chuckle was this person said she had spent weeks preparing this presentation to give in front of her research lab. It was a big deal. She got up there, she delivered it with so much enthusiasm. She expected, she thought she deserved, and she expected this huge round of applause. And when she finished, she looked out at the audience, and everyone looked confused and angry. And she talked about being crushed in that moment, but how, their very good questions about her work led her to understand that she was not prepared well enough for that presentation. And so that was, to me, that was really funny, because she did it in a very fun way. But it also showed how she had failed at something and didn't get what she thought she needed or she deserved. And then, of course, anything else questions, I would do why USC. Okay, North State. So why CNU? Again, two or three things about the school, tie it back to your goals. I know CNU pretty well. I've been there many, many times. I go every summer and spend a day there. So I can help you with that a little bit. And Elk Grove is right next to Sacramento. And so they want to know basically how has something you have done from your past prepared you to serve the diverse community in the Sacramento or Central Valley. So North State is similar to UC Davis in that they are looking for folks who want to stay in the area. At the same time, they take out of state people, so I'm not really sure what that's about. But they do have a regional commitment. Biggest challenge we have talked about a lot, and what direction do you like to see healthcare progress? So you can talk about anything. You could obviously everyone talks about access. That's like the most obvious thing. If you don't want to be about like everybody else, then just generally try not to talk about access for every single answer that has is possible. Every person defaults to access. Be more specific. Like think of something about access that you would like to see changed. And this is talking about healthcare progress, like healthcare, not just um, I guess that works. Like you could talk about like telemedicine, AI, I mean, so many things. If your education is not okay, so this is pretty simple. Oh, they also have one, it's not on here though, but they have one that asks if you've worked with an advisor. I don't know why this is cut off. I think maybe I didn't, maybe it's down below and it got cut off. So there's actually two more questions. There's one about how you study for standardized exams, and there's one about whether you worked with an advisor. Um, for some reason, people feel like they like act like they don't want to work with an advisor, which really baffles me. Because like most med schools want you to work with an advisor. So you saying like, oh, I did everything independently and asked my friends and blah, blah, blah. Like that would not be the best answer. The best answer is I did work with my advisor. Um, and some people don't mention me, which I don't care. If you don't want to mention me, fine. But A, they know me, and B, you don't have to use my name, but you can say like I work with a professional advisor. Absolutely no shame in doing that. If you think there is shame, well, I don't know what to tell you. But it's okay. Like there's nothing that you have to hide there. So I think if you have not worked with an advisor besides me, it would be better to say you work with a professional advisor than to act like you work with no advisor. You catch my drift? Okay, well, I think we're almost to the end. Loma Linda, not all of you are applying to Loma Linda, which I think is appropriate. If you are applying to Loma Linda, but you have not seen their secondaries yet, I am going to just let you read these and decide for yourself if you would like to apply to Loma Linda. You do not have to be Christian or Seventh-day Adventist or whatever they are. Yeah, Seventh Day. You do not have to be that to get into Loma Linda. When I visited Loma Linda a few years ago, I saw lots and lots of students who appeared to be Muslim. I would assume they were Muslim. So I would not worry about that as much as making sure that you are able and willing to abide by their, um, I guess, rules is how I'd put it. They make you sign a contract that you're not going to use any substances or partake in other behaviors that would be um, Not appropriate. So if that's not for you, then don't apply. Any questions? Are there any questions about any of these questions you need help unpacking? All right, Charles Drew is also one that most people don't apply to. If you feel a very strong commitment to the Los Angeles community, you definitely can apply to it. 100% wanting people to stay in the region. You need to know about the region. I would write everything about Los Angeles. Um, so Charles Drew is a HBCU. I have had people who are not black get into Charles Drew, but I've had people who've gotten into Charles Drew who have had a lot of problems with the process. So they're not super organized in the admissions process, which turns a lot of people off and along the way. And they also, like I had a situation one year where someone was accepted to CDU and was accepted to UC Davis, and the person was from Los Angeles, but CDU was making them repeat a class that they said was like too old. Apparently they took I guess they like enforced the time limit on classes, which is the only time I've ever heard of this happening. But he was accepted actually to multiple schools, not just UC Davis. And he was like, "Well, you're the only school asking me to take this class over. Everyone else said I'm fine." And they're like, "Yep, sorry, that's what we want." So, of course, he didn't go there because why would he take a class over when everyone else said he's fine? So I mean things like that. I haven't had a lot of people go to Charles Drew because they we tend to run into some issues. So if you really want to stay in LA, it's worth applying to. But if you do run into some issues, like just know it's not unusual and we can work through it. But that's kind of been my history with them. So unless you just like really don't like if you don't have strong feelings about serving in LA, I probably would not apply to Charles Drew unless you feel a strong tie to that community. Stanford, most people don't apply to Stanford, unless you feel like you really are a good fit for Stanford. These are the questions. Again, not super long. 1,000 characters doesn't give you a lot, but you do need to have a very clear understanding of what you want to do. So they do ask you to commit to what your practice looks like. So they make you pick one of these areas, which is what I pretty much tell you to do anyway in your personal statement. So make sure the one you pick here is the same thing you already said in your personal statement. And then, um, why do you want to do that? The Discovery curriculum lets you sort of choose an area outside of medicine, of course, that you're interested in. So you need to look through that, pick something out, and say why you picked that. You need to describe your family background. You need to um, say what the value you bring to them. Yeah. I mean, it's pretty straightforward. It's just, it feels kind of repetitive. It's like number three, or this one, describe which aspects of your life experience would help you make a distinctive contribution. And then the last one, or second to last one, um, no, the last one, how you may uniquely contribute to Stanford medicine. I don't quite know what the difference would be there. I think I would just pick different things about yourself and highlight them in those different spaces. I don't think so, Aaron. I'm not going to get comfy in the ocean ever. I've been to so many beaches. I've been living by that. Actually, you know what did it for me was New York, because when we lived in New York, I lived 20 minutes from the ocean. So we went to the beach all the time. And on more than one occasion, there were beached whales on the beach where we had dinner, large ones. And I'm like, and then we did whale watching a lot. And I'm like, okay, I saw the whales in the ocean and it was not that far out, like maybe an hour out. And those same whales were beaching themselves on the beach in which I swam. So if they came all the way up to the beach to beach themselves, if I was in the water at that moment when that whale decided to swim up on the beach, could you imagine? Because they don't know the time. They don't know if I'm in the water when they decide to beach themselves. I would literally have a heart attack if I looked down and saw a whale next to me in the ocean. So no, 100% no. It was sad. Yeah, they would stay there for a couple days and then I don't know what they did with them. but there was always like crowds around them. It is sad. It's very sad, but also kind of interesting. Um, so let's see. I think that was the last California secondary. Did I miss anything? Did I forget one? I didn't do the DO ones. We can do a DO one later. Okay. I'm gonna open the floor for any questions. We went an hour and a half. It's 9:30 my time. Any questions about anything?
I had a super quick question, Joanne. For those questions at the end, I think it came up like 3 times here. Like anything else you wish to share with the admissions committee, you'd recommend that you always do like a why this school
If it makes sense,
answer.
like if the question is really generic like that, then yes, I would do why the school. If it's like
Okay.
something that says has any nuance to it and it doesn't feel appropriate, then no.
Okay. And in that case, like, would you recommend leaving it blank or just like expanding on a most meaningful? Okay.
No, so that's what I was saying before. Don't just use random spaces to tell them more things about yourself.
Right. Right. Okay.
It looks like you have no self-control.
Got it. Okay. Sounds good. Thank you.
Any other questions? Okay. So, how are we feeling about things right now with this process?
I feel overwhelmed, but also like I feel a lot better. Like I have a lot more direction too at the same time.
Okay. All right. Good. I think overwhelmed is
Yeah.
a normal. You like the UC questions. Okay. Well, there we go. We have someone who's down for it. I think from a if I was like in my med school era, if I was wearing my med school hat, I understand completely why they're asking these questions. The thing I dread about these questions is not the questions or reading the answers, it's watching you guys agonize through this. Because some of you, it'll be no problem. You'll have great things to say. And some of you, many of you, will struggle with coming up with something to say. And the hard part for me is that because I see all of your answers, I'll know what really good answers look like. So when I see a not really good answer, it's really hard for me just to go, oh, yeah, that looks great when I know it doesn't look great. And so I have to try to get you to a point where it does sound really good. Um, and it's harder for some people than others. So it's hard when the questions are hard because it requires more of you. It requires you to think harder, rewrite more often. And sometimes it takes a couple of rounds and it's frustrating and you guys get irritated and I get that. So we'll do the best we can. I literally also wrote overwhelmed in the chat, but it makes me feel empowered. Yeah, I think that's true. I mean, when you know what's coming, you can get ahead of it, right? We don't have to let it control us. I think, um, I think this is, I mean, obviously I've done this 11 times and everyone in each group has got it done and I know what I know for you what it's going to be like. Maybe you don't know quite yet what that's going to be like. I'm telling you, it's going to take everything out of you and anything you can do. So one thing that my other, like, people have told me that helps them is, um, plan something at the end of August. So set a goal, like plan a trip, a girls' trip, a mom trip, a parent trip, whatever you want. Plan a trip, go by yourself. But plan something where at the end of this process you can reward yourself. And if you can't go on a trip, then just plan like a night out with somebody. But you need to reward yourself because if you have something to look forward to and you say, okay, I'm going on a cruise at the end of August, then you will get your secondaries done by the end of August, I promise you. Because nobody wants to do secondaries on a cruise. So, plan something so you do that. Also, create systems where you can reward yourself. I always say, go sit in a restaurant and work, get your favorite dessert or get your favorite drink. You need to relax. You cannot write when you're stressed out. So, you need to make sure you get yourself in a relaxed state and do some free writing. Will other advisors send it back if they think we need to rewrite an answer? Yeah, they're not nicer than I am. Sometimes they're nicer than me, but I mean, if you've worked with and if you've seen feedback on my other advisors, some of them are harsher than I am, I think. Like I always like, that's not that bad, and they'll be like, no. So you don't have to take everybody's feedback. If it's too harsh, you can just be like, yeah, no, I'm gonna leave it. But 100% they will tell you to rewrite it if it's not good. Usually, like, so I have advisors at different schools, and for example, like MCW, I'm going to send your MCW to Michaela to do. I'm going to send your Loyola to Gabrielle. I'm going to send whatever school you're applying to, I'm going to send it to them if I have someone there. Um, so yeah, my other advisors will definitely help for my cohort people. Any other questions?
Yeah, I have a question, Joanne. Might be a hard one, but someone that's like glued to the outcome with all these secondary writings, like how do you suggest staying like mentally okay with like I don't know. I always just think that like I'm gonna do all this effort and all this writing and like there's a possibility that like I won't get an interview, I won't get accepted, I'll have to reapply. Like,
Well, I think we just have to have like blind toxic positivity right now, right?
okay.
Like if you let
Yeah,
yourself go there, then it's like, what's the point of doing any of this?
that's true.
There's no evidence at this moment that it's not going to work for you. Any evidence that you have, you've fabricated. So,
Okay.
um, I would say letting yourself like spiral like that is something you have to work on avoiding because it's easy to imagine it not working out, but if you flip a coin, it's just as easy to imagine it working out.
Hmm. That's true. Okay. Thank you. Sorry, I just want to be vulnerable there. Like,
Oh yeah, no, no, it's
yeah.
real. I think that's a very good question.
Yeah.
And you will have all of you will have many moments where you let yourself go there, and I will kindly remind you to not let yourself go there because there's only so much mental energy you have in a day, and you can't spend it on things like that. There will be a point where you guys get really discouraged and really tired and just fed up. And if you need to vent, then you just make an appointment with me and you just get it all off your chest and say all the things to me. I'm used to hearing it and I will let you say all those things and then we'll talk about it. But don't keep that in your system too long because it'll eat you alive and you'll start getting really, down. And that's when I see people kind of check out. Like in the secondary process, you cannot check out. You cannot be like, I'm gonna disappear for 2 weeks. You can't. You have to stay on it consistently. So, um, yeah. I'm kind of letting some people check out now because the MCAT, once everyone's done with the MCAT though, no more. Y'all gotta be on it all the time. Okay? All right. Well, hang in there, everybody. If you are done with your primary and you're not studying for the MCAT, this should be what you're doing all the time at this point. Um, I, you know, I was explaining this to someone earlier. You're doing a lot right now, so you can either be really stressed right now or you can be really stressed later. It's not going to, you're not going to have a situation where it's less stressful than right now. So if you do 2 week right now, it's very lovely. You can get through this process coasting, no stress. You keep procrastinating on this, and then you're doing 4 or 5 a week. Um, One way or another, these secondaries are getting done. And if you want them done well, which I assume that's why we're all here, right? What's the point in submitting crappy writing? Then you're going to be sleeping less, taking more days off work. Um, Crying does not help you get secondaries written. So there is no wiggle room for like feeling bad about it or taking a day off and self-care. There's no self-care in the midst of this. You can do what you can for self-care, but if self-care for you is taking a break, you cannot, or you're gonna be like dragging this into September. So, I mean, yeah, you can have an afternoon off, but like some people think like, oh, I'm gonna take a week off. I don't know. I think if you're serious about wanting to apply early, then you can't really do that. You're gonna have to just touch it a little bit every time. And you have to create the conditions where touching your writing every day it isn't a matter of suffering. Go work at a bar, have a glass of wine, and write a secondary. If that's what you need to do what you need to do. I've had many nights where I've sat at bars and read secondaries because as agonizing it is for you to read them, after I've read 30 answers of the same answer for schools, like I cannot, like I'm pulling my hair out, like I can't read this answer one more time. But I do, every year I do it. How do I do it? I try to make it as enjoyable as I possibly can. So you only have to do it once. Just remember that. You would do this one time really, really well, You never have to do it again until 4 years when you do your residency applications. So I shouldn't say never again, but you have a little bit of time. Okay, well, friends, I'm gonna let you go because I need to go to bed. So I hope this was helpful, and I'll probably do another one soon on, I don't know, maybe some other subject related to secondaries. And I'll probably do some, I mean, I'm gonna do a generic secondaries boot camp where I'll just talk about all the other schools outside of California. I'll post this in the applicant group or on my YouTube channel. I'll probably post it on my YouTube channel because I want you all to go to my YouTube channel and like my videos, please. Okay, have a wonderful night, everybody.
Thanks,
Thank you.
Joanne.
You're welcome.